Okay, I think we're ready to get going here. Welcome again. We're delighted that you're joining us for our webinar today, Building Healthy Communities, COVID-19 and Equity in New Hampshire. My name is Tim Sink. I'm president of the Greater Concord Chamber of Commerce, and I'm really glad you're here to hear from some really terrific presenters on this subject. A little background on the Chamber. We have created and archived numerous resources that can be accessed at concordnhchamber.com, helping folks navigate through this COVID crisis, all kinds of programming and things that can be very, very helpful to you. It's accessible. Go to concordnhchamber.com. We've got all kinds of webinars that we've done, help you walk through a number of different issues and categories. And we're continuing to build upon those resources for you. They're free, and so we would encourage you to please take advantage. So to get started, in order to set the table, I'd like to invite Jaime Simoes to make some opening remarks. Jaime is the principal with Lewis Carno and Company in Concord. So Lewis Carno provides numerous advertising and market research and public relations and social media services for clients from throughout the region. Jaime is a very active member of the Chamber Board of Directors. He is the chair of the Creative Concord, our standing committee that advances the creative economy in Concord, and he is also active in Protect Our Care NH. So he'll take Jaime, would you take a moment and sort of open up the program for us?
Thank you, Tim. It's always a pleasure and an honor to work with you. And as you said, I serve on the board of the Concord Chamber, as well as chair Protect Our Care NH. I want to thank the Chamber and all the participants today. And I also want to say thank you to Granite State Progress for their help. So this is an important opportunity to take a close look at our state. Racial health disparities are linked to substantial annual economic losses, including healthcare expenditures and illness-related lost productivity. Disparities in health and healthcare not only impact the people facing a health gap, but limit overall gains in the quality of care and health for everyone. Addressing health disparities is increasingly important as our New Hampshire population becomes more diverse and as we as a community struggle to overcome this pandemic. Now, although the Affordable Care Act has led to large gains in coverage, communities of color in New Hampshire remain at a higher risk of being uninsured, lacking access to care, and experiencing worse health outcomes. That is not the New Hampshire I want to live in, and I know that we can do much better. We can start by having this conversation, and then we can work to protect the Affordable Care Act, and we can continue to strive to make New Hampshire a more welcoming, inclusive place. Thank you.
Thank you, Jaime. It's now my pleasure to introduce our three panelists that will carry the water for this particular program. I did want to make one comment. There will be an opportunity for Q&A, and you can ask questions by just clicking on the Q&A button at the bottom of the screen, and we're going to let the panelists do sort of an interactive presentation for starters, and then at the conclusion of their presentations, we will go through your questions. So as we're going through the program, please type in your questions at the Q&A button, and we will pay attention to those. So our panelists today, Kirsten Durzy serves at the Evaluator for New Hampshire Division of Public Health Bureau of Infectious Disease Control. In this role, she provides guidance and consultation to public health programs in the creation and implementation of plans to assist programs in understanding their impact, assess their need, and inform their development. Kirsten has worked in community health and education settings in multiple states with higher education, tribal communities, nonprofits, and the public sector in multiple states. She has provided expertise in strategy, governance, community engagement, and facilitation of various public-private collaborations and coalitions across New Hampshire, most specifically in the areas of evaluation, HIV, and building equitable organization. Kirsten serves as the equity subject matter expert for the New Hampshire DPHS Incident Management Team for COVID response, co-leads the New Hampshire COVID Equity Task Force, and serves on the New Hampshire Governor's COVID Equity Response Team. Jessica Santos, our second panelist, or an additional panelist, Dr. Santos is a researcher and educator with expertise in social inequality, workforce development and diversity, refugee and immigrant integration, and empowerment economics. She is a scientist and the director of community engaged research at the Institute on Asset and Social Policy at Brandeis University and a lecturer at the Heller School. Prior to joining IASP, she worked at the New Hampshire Department of Health and Human Services, Office of Minority Health and Refugee Affairs, where she developed and managed projects to further health and equity in New Hampshire. Jessica spent 10 years designing and implementing projects to improve the well-being of families and communities in New England and Latin America. She also worked with partners to secure millions of dollars in public and private funds for public health and economic inclusion in New Hampshire. Her current work is focused on learning from the intersections of research and practice to reduce inequality and bring innovative policy and program solutions to scale. Finally, Dr. Trinidad Tellez directs the Office of Health Equity and assures equitable access to effective, quality Department of Health and Human Service programs and services across all populations, with specialized focus on racial, ethnic, language, gender, and sexual minorities and individuals with disabilities. OHE provides coaching and technical assistance for organizations to serve all people with high quality care and services, communication access, organizational cultural effectiveness, equity, diversity and inclusion, data collection and the use to identify and address disparities, immigrant refugee integration, and more. Dr. Tellez champions participatory process, authentic community engagement, and community-driven approaches to promoting equity. She co-leads the COVID-19 Equity Task Force. And so at this point, I would like to turn the program over to our panelists to present the program. So thank you all for being here. We really appreciate your participation.
Good morning, actually good afternoon. I'm Kirsten Durzy, and I was given the unique task of kind of leading us into this conversation, and I thought a little bit about how I wanted to do that. And I think one of the things that I'd like to talk about is the effect of a pandemic on a community. And when we think about something like a pandemic, it's important to think and remember that it's a unique event, but it's not an isolated event. So a pandemic or any other public health or any other emergency that's widespread, when it hits, it sort of rolls in a little bit like a tsunami. And like a tsunami, it brings everything that already existed with it. So it brings with it all of the inequities and disparities that were already existing. But as it continues to roll in, we see that it begins to further widen those gaps. So I think that at this point, we've probably all been painfully and acutely aware of the tragic impact of COVID-19 on communities across the world, across our country, and here in New Hampshire. And I would hazard to say that we probably all have had a significant personal impact by this point as well, whether it's the loss of a job, or a loss of your housing or your home, or just the loss of feeling safe in your own community, or feeling like you have the freedom to move about like you did before. And for some of us, we've had even a more significant loss of a loved one or somebody that we know. And I think, it's probably fair to say that we've all been watching the news, maybe more than we should, but we've all been paying very close attention to the news. And the stories that are unfolding across the country, and how the data and the stories are telling us about this disproportionate impact amongst some communities, and particularly communities of color. And that is not a unique story to certain places in the country. That is relevant across everywhere in the country, and even here in New Hampshire. I think there are going to be lots and lots of stories to tell about this pandemic as it rolls out over the next months and years. But this story about this disproportionate impact to some communities is going to be one of the most significant stories to tell. So I'm going to hand you over to Dr. Tellez, and she's going to take you through looking at some of the concepts that might help you think about why some of these disproportionate impacts and inequities are happening. So thank you.
Thank you, Kirsten. So I find it's always helpful to start with discussing some of the terms that we're going to be using today. And so disparities and inequities is where we'll begin. And it's helpful to think about the kinds of differences we see and consider whether they are expected or something else. So as an example, on the left, young adults are healthier than the elderly population. As we think of that, is that something that is expected, or is that something that we find worrisome or bothersome? And I think most of us would say, well, it's true, it is a difference. However, it's understandable as a normal part of the biologic process of senescence or aging. And so we don't find that worrisome. But if we see that there are differences in nutritional status or immunization levels between girls and boys, we might stop and ask, why? And if we see, and when we see that there are racial ethnic differences in the likelihood of receiving appropriate treatment for a heart attack, that definitely gives us pause. And so it's helpful to differentiate that disparities are differences that we see, whether it's in the incidence, prevalence, mortality, burden of disease, or other adverse health conditions, or other kinds of difference, such as in education or in other fields. Those are differences. But inequities are when those differences in health are unnecessary, avoidable, unfair and unjust, systematic, and socially produced, and thus modifiable and unfair. So if those are inequities, what is equity, and specifically health equity in this case? Well, the Robert Wood Johnson Foundation brought together a lot of thought leaders in this space, and in 2017 produced a 40-page report, What is Health Equity and What Difference Does a Definition Make? And in a nutshell, it boils down to this simple phrase. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. And so some of us may have seen this graphic or another similar graphic that helps to differentiate what do we mean by equity versus the very familiar concept of equality. In the top lane, we see a depiction of 4 individuals who are all given the same thing, a bicycle of the same size that actually only works for one of the people. In the bottom lane, we see people now able to ride the bicycle that they have because they're given what they need. And so in this case, we do have different bicycles, but it's meeting their needs and it's affording equality of opportunity to enjoy the bicycle ride or to ride the bicycle, which is the point of having the bicycle. This is a very helpful framework. It's derived originally from the Bay Area Regional Health Inequities Initiative called BARHI. It has been adapted in multiple states around the country, and this is the Vermont adaptation. We're going to read from right to left here. And so on the far right end, what we call downstream, we see here disease and injury or illness and mortality or death. And this is where we usually think when we talk about health, because oftentimes we're actually talking about health care. We talk about health insurance. We talk about how much things cost. We talk about the percent of the GDP. We talk about whether or not we have access to health insurance or can get to the doctor. And what we know now is that health care at most determines about 10 to 20% of our health. And what really is most important for determining our health status is what we call these upstream factors. And so this depiction helps us move further and further to the left. Apologies for the advancement. So we see that there are risk behaviors, and those do play a role. But more importantly, here in the middle, we have this box entitled living conditions, which we sometimes call social determinants of health, and oftentimes environments where we live, learn, work, play, and pray, or the conditions in which we lead out our daily lives. Things like education, things like built environment, green space. Do we live in a food desert, or do we have lots of plentiful access of fresh, healthy foods? So those are social determinants. And increasingly, we realize that they play such an important role in our health status and how sick we may end up getting. But this graphic helps us look even further upstream than that, to institutional inequities. And as people in government, we especially need to be attuned to whether we are contributing to or creating inequities in the way we distribute investments, wealth, and power that then play out in the social determinants and then manifest in the disease and illness that we see further downstream. But even further upstream than that, we have what we think of as the structural determinants, the underlying social inequities, which are prejudice based on the social categories of race, class, gender, sexual orientation, and ability, the various isms that manifest at every point along this continuum. And so social inequities that then impact the institutional inequities that may be created or widened, that then manifest in social determinants, that then play out in even greater cumulative effects for some people compared to others at this stage of disease and injury and mortality. So when we're thinking about equity, we also need to think about measurement, because without measurement, there is no accountability. And so health equity means reducing and ultimately eliminating disparities in health and its determinants that adversely affect excluded or marginalized groups. And so what would equity look like? Well, it would look like no difference between groups. And I think we'll agree that we don't often see depictions like this. So we could imagine you might have an access measure, such as do people have access to testing, or utilization or outcome measures, such as what are the results of those, what are the testing results? And these different colored bars for each of these different indicators represent different groups. And we could choose to slice and dice the population by any of a number of ways. We might want to differentiate or disaggregate the population by education. So, group one would be lower education, and up into 4 categories until we had the higher education group. We could do it by income. We could do it by racial ethnic groups. We could do it by geography. We could do it by housing status. And so the point of this is that there are many different ways to subdivide the population as a whole so that you can try to identify important variation. And this concept is called disaggregation. So it's important that we start with data when we want to promote equity. And so we're going to talk about COVID specifically. Originally, looking at the population as a whole, and this is even back in April, we started seeing the number of cases was rising, and it was significant. And that was mirrored also if we looked at hospitalizations. But again, this is the population as a whole, which doesn't reveal much information about how various subpopulations are affected. But this is COVID hospitalization rates disaggregated by age. And this now reveals important variation. And this is how we were able to figure out that COVID was significantly impacting older individuals, much more so than younger age groups. And this was an important bit of information. So this concept of disaggregating allows us to see important differences that permit targeting improvement efforts. And so in New Hampshire, this is the state's COVID website, and the arrow indicates where you find the information for the summary dashboard of the COVID data. And this is what that summary dashboard page looks like. And I'm going to pay special attention to the race ethnicity table on the bottom left. At this point in time, and this is data I double checked today, it's as of last night's numbers, there were 6,619 infections total in New Hampshire, 698 hospitalizations, and 418 deaths. We're going to talk specifically at first about the infections or cases. Those are people who've tested positive. This table is the breakout of race ethnicity for the various people who are in the different categories of either infections, hospitalizations, or deaths. And what we see is we had race ethnicity identifying data for 5,832 people. So that means we only had race ethnicity identified for 86.8% of the 6,719 people with infections. Now, the same here, we can see that we had race ethnicity identifying data for 93.3% of people hospitalized and 98.6% of people who have passed away. And so this is important because I'm sure you can understand we would want these numbers to be as close to 100% as possible so we can be really confident that the conclusions we are drawing are accurate. I do want to point out that since we started tracking data and this breakout into the three categories began with the weekly report of April 27th, at that point in time, we only had race ethnicity identified for 79% of infections, 86% of hospitalizations, and 67% of deaths. So everyone collectively has really worked together to try to make sure these numbers have improved significantly over time. So we have much greater representation of the race ethnicity data in our populations that we're examining. That's a wonderful thing. Now, additionally, the important point of this slide is that if we look specifically at Hispanic or Latino, we see that 13% of the people with COVID are Hispanic or Latino. And that is over 3 times higher than the frequency of the population in New Hampshire. And that for the Black or African American population, 5.8% of the cases are Black or African American people, although they only represent 1.4% of the population in New Hampshire, and that's over 4 times. And so this being over 3 times the presence in the population and over 4 times the presence in the population is this concept of disproportionality, that we're seeing COVID occur at a much higher rate in that group as compared to their frequency in the population. And I want to add that when we see disproportionality and overrepresentation in some groups, that means we also see underrepresentation in other groups, and we'll be exploring what that means a little bit more later. I want to add that a really important piece of information would be the testing and what is the distribution among the different populations of testing, who has access to testing, and especially when we know that some populations are particularly at risk and vulnerable, we want to be able to assure that everyone that needs testing is getting tested. Now, this is being worked on, and we're really pleased to announce that there is a new and improved COVID-19 data dashboard being released very, very soon. This is the website for the home page of the COVID site, and that's where you will be able to link to it imminently. And so we see that these numbers are revealing the kinds of inequities we've been hearing about from across the country in New Hampshire, just like elsewhere. And the COVID-19 pandemic is simply unmasking the long-standing underlying structural and systemic inequities. And so let's look upstream now and learn a little bit more about what that means.
Thanks, Tony. So I'm going to spend a few minutes talking about why we have the disparities that Trini has shown us here in New Hampshire and across the country, and what does the economy have to do with all of this. So I'm going to do that by returning to this beautiful infographic to focus just on the upstream side of the picture. And if you look at the red circles, I've highlighted a few areas that I'd like you to focus on. First, the social inequities of prejudice based on the social category of race. Second, the institutional inequities of how resources and power are distributed in our very communities here in New Hampshire. And then third, in the living conditions, I'd like you to start thinking a little bit more about employment and income. And as I go through these following slides, just think about your own community where you live in New Hampshire. So we've spoken about disparities and inequities, and this definition of health equity is very helpful in my mind in thinking about what does all of this have to do with the economy. So if health equity means that everyone has a fair and just opportunity to be as healthy as possible, how do we make that happen? We must remove the obstacles to health that we've just been looking at in that picture, such as poverty, such as discrimination, and also fix the lack of access to good jobs, the social conditions, fix the lack of access to quality education that structures our communities to produce inequities. So I'm going to start by looking at how are our resources distributed in this country. Let's ask this question. I would say that although people tend to talk about poverty as a significant driver of health disparities, I argue that it's actually not poverty, it's wealth inequality that is the driver of disparities. Poverty is a symptom of that inequality. And as you will see, the wealth distribution in our country is vast, it's getting worse. In the late 80s, 1989, the top 10% of all Americans owned 67% of all the wealth in the country. Now in 2016, that same group of people, that top 10%, owned 77% of the wealth in our country, and it continues to get more unequal today. I also want to point out that with the yellow and green parts of this infographic, you'll see that as the wealth of the top 10% has been growing, the wealth of the middle class and everybody else in this country, the bottom 50%, has been declining. In 2016 and still today, about 1 in 10, so 10% of our entire country has a negative net worth. What that means is, and here remember, we're looking at wealth distribution, not income distribution. So when we talk about wealth distribution, we're talking about, sure, we're talking about income as part of it, but we're talking about home ownership, retirement, land ownership, business ownership. We're talking about stocks and bonds, and the inequities that we see in our country are much greater in wealth than they are in income. So when you see that figure that about 10% of our population has a negative net worth, that means that they have debts that are greater than what they own. And now let's look at poverty rates, because I do see wealth and poverty as interlinked. As Trini was describing with the example of COVID rates, when you look at data and you see overrepresentation in one population, you also see underrepresentation in another population. So equity, if those bars on the graphs are going to be all the same, means that it's out of balance. So when one group is underrepresented, another is overrepresented. It goes the same way with wealth. When 10% of our population hoards or owns all of that wealth, then it is going to create the poverty that becomes that obstacle to health. And as you can see here, when we start to look at this from a racial and ethnic perspective, this is in the same time period, basically the 1980s, right, going forward, you'll see an incredibly stratified and also stagnant, unchanging picture of racialized wealth inequity and poverty in this country. So here you can see the purple and blue lines are white and Asian American populations have the lowest rates of poverty, and then Hispanic, Native American, and Black populations have higher rates of poverty. And this is consistent over time, despite fluctuations in the economy, which you'll see around 2009 with the recession, and we're also going to be seeing that now based on, you know, the COVID-driven recession that we're entering into now. So although wealth inequality continues to increase and benefit white populations more than communities of color, the poverty rates in this country are incredibly fixed and stagnant. So I want to add gender into this conversation just briefly. If you think again about when we're not just talking about income, we're talking about wealth, we're talking about ownership of assets. Who owns the assets in a family? Who has access to resources when they need it? How are those resources distributed? I want you to think as I talk, if you think about on average, for every dollar owned by white men in this country, how much do you think, in cents, because we know it will be less, that Black and Hispanic women own? So just try to come up with a number in your head for every dollar owned by white men in this country. How many cents do Black and Hispanic women own? And it is less than 1 cent. So as I was saying, wealth is different than income. It is more complex, and in order to, you know, create a prosperous and an equitable economy, we need to be thinking a lot more broadly than just about income. However, income does matter, and it also matters more for families in poverty because they are less likely to have access to other sources of wealth like homeownership or retirement funds, etc. So this is just to point out that income inequality is also an issue that we need to be paying attention to. The highest earning 20% of families in this country made more than half of all the US income in 2018. So I'm going to pause now and see if any of this is making sense to connect to it to the COVID context that we started this webinar in. How exactly do all of the inequities and the wealth distribution that I was talking about, how our economy and society are structured, how does that actually create disparities in COVID outcomes? So one, as I've been explaining, the way our society and economy are actually built and structured is to create these inequities. So we see that through the, when we look at disparities numbers, those are outcomes of inequities. So we see that we don't all have equal access to safe housing and home ownership, and we see the disparities in income that we just pointed out, access to quality jobs, not just an income through a job, but quality jobs that have benefits that provide you with and your family with that access to a retirement fund that will grow over time, access to health care through your job, to health insurance. We know that in neighborhoods, institutions are, you know, in one town you may have very high quality healthcare, whereas the next door town may have lower quality. So even if you have access to an institutional resource, the quality differs, etc. So, okay, so we have an economy and a society that is structured in a way that we know people have different levels of access and ability to create the conditions that allow them to achieve health, right? Then, so these inequities mean that people of color and people with fewer resources are more likely to have underlying health conditions. So we see disparities in many different types of health outcomes, not just COVID rates. And then those underlying health conditions mean that people of color and people with fewer resources are more likely to have higher levels of COVID rates. So number 3 is our population does not start from the same place, both in terms of underlying health conditions and those resources to survive when a pandemic hits. So I've spoken a little bit about the fact that our society and our economy is structured in a way that creates these inequities. What do I mean by that? And this is not always the way we've been taught about how our policies are made in our country. So just to remind everyone, this is a mini history of looking back to the late 1700s, all of the policy-driven blocks that have blocked different communities of color from building assets since, basically the late 1700s to present. So I'll just go from top to bottom really quick. The red line is Native American and Native Hawaiian and Pacific Islander populations blocked from land ownership, the Indian Removal Act, Hawaii annexed, etc. The brown is African American and Black communities, slavery, Jim Crow laws, FHA redlining, etc. These are specific policy-driven blocks to asset building that have affected families over generations and that result in the wealth inequities that I was talking about today, the racial wealth gap specifically. If you look at the orange bars, that's Hispanic Latino population blocks, Mexican land loss, annexation of Puerto Rico, border patrol immigration policies, etc. And then finally, the pink is Asian American, Chinese Exclusion Act, Japanese internment camps, etc. So now you can see what I mean when I say it's structured in a way that has prevented certain groups of people from creating the wealth and the resources that they need to achieve the best health possible. We still have many policies today that fail to correct for the wealth inequities that I'm talking about. Here is just an example of two, home ownership and retirement, looking at who benefits from the tax subsidies that are built into our tax code. The top 20% is the darker bar. You'll see that they benefit most and can earn more in their overall net worth because of already owning a home and because of having a retirement, having access to those asset building opportunities. So to drive the point home, I like to say, okay, we all wish we lived in a meritocracy. We all do. We all wish we lived in a society that gave us all an equal start, where we could just work hard, add an additional dollar to our paycheck, and that would pay off. Now, some of our research at the Institute on Assets and Social Policy has gone in depth to look at what is the added benefit for families when they engage in these activities of higher education, an additional dollar through earnings, etc. What's the payoff? It turns out that, of course, the payoff is not equal, right? So if you add $1 to your paycheck in a white family, the return to that dollar is going to be a lot higher than the return to that same dollar for Black families and Latino families. Why? Because of those underlying wealth inequities. So you need wealth to be able to build more wealth. You need it across generations. You need it structured through policy, and you also need it to be accumulating over time. So yes, this is all true for New Hampshire. Here is just one example of some poverty rates by racial and ethnic group in New Hampshire, just to show that everything I'm talking about may feel far afield, but I said, remember, think about your communities, think about what you know about how our society is structured in New Hampshire. We see disparities in poverty rates by race and ethnicity. We also see that furthest right foreign-born bar, and I just want to call that out for a moment and remind everyone that the foreign-born population in New Hampshire maybe gets a lot of press and is often who people think of when we're talking about people of color. However, about 50% of the foreign-born population in New Hampshire is white. And so I just encourage everyone to be very careful in thinking about, are we talking about people who are foreign-born immigrants or children of immigrants? Are we talking about race and ethnicity specifically? What are the factors that we need to be looking at when we think about creating welcoming, inclusive, and just communities? Finally, I mentioned, the distribution of resources. Again, we know this stuff instinctively. If you live in Concord, you know how different the resources are than they are in Bow. If you live in Manchester, Bedford, etc. So finally, I'm going to end by suggesting that we have a lot of work to do. I'm going to assume that everybody on this webinar would like us to move closer to the direction of equity, right? I think we're all here because we can agree that these disparities and inequities are unjust. You know, Trini mentioned that they are systematic. Inequities are systematic and socially produced. So that means that we can change them. If they're socially produced, we can fix them. Kirsten mentioned feeling safe in a community at the beginning of this presentation. And so I'm just going to end by mentioning a wonderful initiative that's been going on in New Hampshire for years, the Welcoming New Hampshire initiative. It's tied to some national work to welcome newcomers, immigrants, refugees, et cetera, and people from other states to New Hampshire. Concord, the chamber, has been a partner in this and is interested in doing more in the city of Concord to become a welcoming community. But I'm going to suggest that based on our conversation today, being a welcoming community is great. Achieving equity or working towards equity is great. And I'm even going to say we need to go a step further, that welcoming, equity, these are good goals. I would say personally, I would encourage us all to think about justice. Given the way that our communities are structured and the long history we have that has gotten us here, I tend to think about welcoming, I think about equity, but most importantly, I'd like us to think about justice. So thank you.
Well, thank you to Jessica and to Trini for taking us through all of that really great information. And now that we've talked a little bit about what equity and disparity is, how it's evident in our data, and what the up and downstream factors might be that are impacting or causing these inequities, we're going to invite you to join us in a little bit of conversation. And we're going to utilize the chat function or the Q&A function at the bottom of your screen. Either one is available. And the question that we're asking is, as a collective or as an individual, what is it that we can do or you can do to build these communities that are, as Jess said, welcoming, that we can mitigate? What can we do to mitigate some of these inequities? And most importantly, what can we do to build a more just world? So we would ask you to type into the chat or the Q&A your ideas. If you type them into the Q&A, they are entirely anonymous to the rest of the panel. We won't be sharing your name along with your ideas. So we encourage you to give it your best go. It doesn't have to be perfect. It doesn't have to be perfectly phrased. We're just interested in starting some conversation about what we can all do together. So one of the things that, as you're thinking about that, I can share that, as I said earlier, we're all paying attention to the news, and very recently there was a group of over 50 chief equity officers from around the country. Some of the largest organizations, for-profit and not-for-profit, educational and otherwise, came together and produced an open letter to corporate America, where they talk specifically about what corporations can do to further anti-racism and equity within their own organizations. So there are some really interesting ideas there. I would direct you to, you can find the open letter if you're interested in looking at it, and I think you should look at it. It's really interesting. It's at IDEAcoalition, one word, .org. So I would encourage you to go there, but some of the things that they talk about there are about having conversations that are difficult within your organizations. And I see that there's some information starting to come up now. So Trini, are you able to see that, or should I read it aloud? Okay.
Okay, I can read them. So we have, let me go back. A question, what are some things businesses can do to model good citizenship and repair inequality? And I'm just going to read down and then we can pause. Support to preschool children and families to address disparities. Businesses can cap salaries for execs. Provide free chamber membership to minority-owned first-time business owners. And the next one is relevant, so it's provide chamber membership and the government can contribute resources to support minority-owned businesses. Can we look at the equity issue and New Hampshire rebuilding its economy as many families look to relocate here due to COVID?
I didn't catch that one.
Can we look at the equity issue and New Hampshire rebuilding its economy? So I think, you know, the point being that as we need an equitable recovery as
Okay.
many families come to New Hampshire to relocate here. If we know what welcoming looks like to these different populations, if we could hear ideas from disadvantaged populations themselves, great. Support student scholarships for first-generation college students. Somebody asked that we put ideacoalition.org on this list for people to explore.
DEA.
Yep, coalition.org. Address and investigate the impact of the Affordable Care Act on communities of color. Provide connections to new community members that are facing disparities, such as educational resources, financial, social connections, etc. Also have open discussions regarding bias, both gender, racial, socioeconomic.
All I got was open discussions.
Yep. It's okay, we can't get everything on the screen, but we'll make sure to get the main points. More employee-owned businesses and ESOPs to help workers generate wealth.
Is that an ESOP?
ESOP, yeah. What does it stand for again? Employee-sponsored ownership. It's where the employees have stake or have stake in the, or stock in the company. Is it a good idea for the chamber to offer lower cost membership to new Americans? Employee stock ownership plan, thanks. All right, great, these are great.
Shall we go on?
So, and this last comment says, Trini, we had an attendee ask, can you post this website for ideacoalition.org? Yep, she wrote it down in the list.
Okay. Sorry. Sorry, I have to go back.
Well, while Trini is bringing up that next slide, oh, there it is, great. So we wanted to talk a little bit, well, first of all, let me say thank you for your wonderful ideas. I think they really were a great example of how just a little bit of time to brainstorm together can come up with some really fabulous ideas for our own communities. And recently, 5 of us were appointed to the Governor's COVID equity response team and tasked with the job of pulling together a report to talk about the impact of COVID on communities of color, how we can mitigate some equity issues in New Hampshire. And we did this in about a 30-day window. It was a lot of work, but we were able to come together and put an initial report and set of recommendations together. I want to draw your attention. It's a little bit hard to see, but at the bottom of the screen, the report is available at the dhhs.nh.gov /OMH/ I don't know if we can make this any easier to see, Trini, but
that is a live link. So when we release the slides, it'll be a live link.
Okay, so you'll be able to just click the link. That is where, there are other places that the report is available, but that is one location where you can find the full report. And we encourage you, we ask you respectfully to go and read it. And in that report, we also came up with a set of recommendations. We came up with 64 recommendations. So we won't be going through them all here today, but they are organized under what we are calling strategic pillars, and we have 11 of them. And those strategic pillars are COVID-19 specific recommendations, so very specific recommendations about safety for communities of color in essential workplaces, access to testing and treatment facilities if needed, and many other recommendations. We talk about the permanence of needing an equity response team in the state of New Hampshire beyond COVID-19, an alignment of government systems, how we can align systems together to sort of build and amplify equity capacity. We talk about organizational cultural effectiveness, which is a very interesting concept and methodology that you might want to explore. It's provided in great detail in the report. We talk about equitable data practices. We talk about increasing knowledge about New Hampshire, people who are at risk for experiencing disparities in New Hampshire. We talk a lot about systems accountability, and this is really tied to a lot of the recommendations that I just saw come up from you, the audience, how to be accountable within systems, regardless of what sector you're in. And the use of equity, effective equity promoting strategies, resource allocation, equitable resource allocation, which is a really interesting not fairly new concept that a lot of our partners in foundations and philanthropies are thinking about. Community engagement, and lastly, policy. So there are some really good recommendations. We encourage you to go and read the report. We also talk about the historical implications of racism and other inequities on the policies that have impacted the downstream disparities that we're seeing today. And the report, the report was provided back to the governor's office. It was at the request of the governor's office, and we were happy and proud to do that. But the report was really written for the people of New Hampshire, for the people who work in every organization across the spectrum in New Hampshire, or don't work in any organization at all. So we hope that you will spend some time reviewing that report. And lastly, before we move on to see if there are any Q&A, and please do post any questions for us, we just wanted to leave you, and we won't read it aloud, but we wanted to leave you with the foreword to our report. It is, you can read it to yourself or not as you wish, but it really is intended to highlight just how important and complex this work is. It is not easy, it is messy, it is difficult, but it is, we say in the report, worthy of our great state. And so we hope that you will join us in continuing and moving the work forward. And I think we'll move on to Q&A if there are any questions for us, Tim.
Well, there were a number of really great comments that folks were making. And there was one question that I would like to throw out, and that has to do with how this works into a geographic concept. In other words, are health inequities for people of color common across a broad geographic spectrum? You did a lot of work that I think looks into our own backyard, but can you talk to this a little bit about what's happening nationally and beyond?
Well, I can start, and maybe Trini or Jess can jump in. So I think that, you know, every location has its own unique issues, right? Some places in the country have significant geographical disparities based on distance, access to services, access to fresh foods, access to employment, or access to technology that keeps us connected. So in those places, we might see some more significant geographical disparities popping up. However, we do see across the board disparities that are tied to race and ethnicity as well. And I'll turn it back over if Trini or Jessica wants to add anything more to that answer.
I'll add that, you know, there's been some fascinating research looking at the life expectancy of, you know, of people in communities just based on zip code, and it correlates with race, and it also correlates with, you know, like redlining policies that we can trace directly back to the Federal Housing Administration. And so, for example, in New Orleans, you can go, I think it's 5 miles or less, and the life expectancy of 2 communities ranges from 55 to 80, just a couple miles away. So that's a pretty stark disparity, and we don't see anything quite that dramatic in New Hampshire. So it does vary, but like Kirsten said, the trends are the same, the patterns are the same. We need to address this at the national level as well as in local communities.
Thank you for that. And we heard from a top economist from the Federal Reserve Bank of Boston about 6 to 8 months ago, and I'm drawing a blank on the gentleman who was the presenter, but he was quite brilliant, and he was emphasizing some of the points that you just made, and is actually moving into a different career path right now based on some realization that came about from his research into the economy, and these disparities started coming up and really making themselves known to him. So that was really interesting. We're coming up on 3 o'clock. One final question I'll throw out at the panel. You had a list of I think you had a list of many recommendations, but you sort of covered the top 11 ideas. If you had to zero in on what would be most effective in terms of addressing this issue, what would it be?
I think that we were very clear in the report, and we've tried to be clear since, that it's very difficult to pull out one and say one is more effective than the other, because they work in concert and some need to work concurrently. What we can say is that there may be some that need to happen first. So some of those things are really related to more equitable data practices and collecting more data. We need data to inform practice and policy. And if we don't have that data, it's very easy for disparities to become invisible very quickly, except for the people who are experiencing them. So I think that, you know, we can talk about maybe what needs to happen before other things, but it would be nearly impossible, I think, to pull out one recommendation and say this one is important, more important than another.
And the only thing I'll add is, just after the executive summary in the report, we have a table of all the recommendations in the 11 strategic areas, and there's a time factor associated. So we think it needs to be implemented immediately versus more intermediate range or long term. And that again, that's not priority, that's temporality.
Well, we are at that witching hour. I want to thank our panelists, Trinidad Tellez, Jessica Santos, and Kirsten Durzy. Thank you for this excellent presentation. Also, Jaime Simoes, one of my bosses here at the Chamber, who helped orchestrate this and put this together. If you are interested in reviewing this or recommending this presentation to someone else, this will be archived on the Chamber website at concordnh.com. So please share that. We will make that available for anyone who wants to see it. Again, thank you, panelists. Thank you, those who were here for this program, and keep your eyes peeled for future programming. We will continue with our webinar series going forward. Thanks, everyone. Have a great night.
Thank you all.